Hello students. In this session, we'll discuss hepatitis B virus, prophylaxis and treatment. So vaccination part is very important one. So most of the times you will be getting this question in the university examination or even in the Viva. So prophylaxis is nothing but like prevention such as vaccination, and even we'll discuss about the treatment strategies. So as we discussed in the previous classes, like hepatitis B infection takes place after the like a blood transfusion, such as contaminated blood as well as the like blood products. So after collection of blood from the donor, if it is not properly screened, and if we transfer it to the like recipient, then recipient will get the like infection. And even we can see in the like drug addicts. So in the drug addicts, they share the like a group of people, they share the like drug among themselves by using of same syringe as well as the needle. And this infection, it is also transmitted by the sexual contact. So especially male homosexuals, they are at the higher risk. And in medical laboratory personals, so such as lab technician and other hospital staff, so even like doctors, nurses and other technicians, so while handling the like infected patients, so either during surgical procedures or dental procedures, they are at the risk. And even like this infection transmit from mother to the like fetus, so infants of carrier mother. So here to like the prophylaxis include general preventive measures and immunization. So again, in the immunization, we discuss active immunization, passive immunization, and combined immunization. So what are the general preventive measures? So general preventive measures include health education. So educate the people regarding the like hepatitis B, like how the infection is transmitted, and give health education to the other healthcare workers, like regarding the like hepatitis B, and improvement of personal hygiene and strict attention to the sterility. And very important thing is like a proper screening of the like a blood bags. So after collection of blood from the donor, so we should screen it properly for hepatitis B. So not only for hepatitis B, so we should screen for HIV, like hepatitis C virus and other viral agents. So we should screen properly the semen donors and even organ donors. And screening of screening for HBsAg, hepatitis B surface antigen, and HBe antigen in the blood donors. So as we discussed in the previous sessions, so HBe antigen is hidden antigenic component. So hidden antigenic component of the core. So generally it is detectable in the blood for few days only or few weeks only. So the people who are having like HBe antigen in their blood, they are considered as like super carriers. They are highly infectious. So we should screen for that. So in case of super carriers, minute amount of blood also can transmit the like infection. So that's what we should screen the like blood as well as the blood products properly. And next thing, use of unsterile needles, syringes, and other materials must be avoided. So you're not supposed to use any contaminated needles or unsterile needles. You're not supposed to use. And important thing is like follow the like safe sex practices such as using condoms and avoid multiple sexual partners. So next immunization part, which is important one. So active immunization. So active immunization is done by giving of vaccines, and active immunization is done before exposure to the disease. So the aim of active immunization is to prevent the clinical attack of the disease. So for active immunization, what vaccine we'll use? We use recombinant yeast hepatitis B vaccine. So what is this recombinant yeast hepatitis B vaccine? So this recombinant yeast hepatitis B vaccine, it is produced by using of recombinant DNA technology. So in this recombinant DNA technology, so we use Baker's yeast. So in this, the plasmid, which consists of gene for HBsAg, has been incorporated. So after that, like the HBsAg particles are produced, such as surface antigen particles are produced, and they are extracted and they are purified for the user. And this vaccine is immunogenic. Immunogenic means, so it stimulates the like immune system. So as it stimulates the like immune system, so this vaccine act as antigen. So against to the like antigen, so the antibodies are produced. So this antibodies gives the like long-term immunity. And this vaccine is like safe and it is free from the side effects. And it is stored in the cold conditions, but it is not frozen. Then what is the schedule? So for adults, so generally we'll give 3 doses, such as like each time 1 ml is given. Like so, what is the schedule here? 0, 1, and 6 months. So what is meant by 0? 0 means suppose if you start the vaccination today, that is considered as the 0 dose, and after 1 month we should give 1 dose, and after 6 months we should give the like another dose. So total 3 doses are given. It is given as intramuscular injection in the deltoid region. So here we are not supposed to give this vaccine in the like gluteal region. So it should be given in the like deltoid muscle. So you can see the schedule. So such as 0 dose. Suppose if you take it today, that is 0 dose, and 1 month later first dose, and again 6 months later. So total 3 doses are given. So what is the dosage here? Like 10 to 20 micrograms per dose. So 1 ml it is given. So here in case of children, so half of the dose is given, which means 0.5 ml of the vaccine is only given. So there will be local swelling and reddening at the injection site. So this occurs in 20% of cases. So which is accompanied by the like slight fever. So like after vaccination, so the like persons like they complain, they will be having the like a slight fever. So we need not to worry. And generally like booster doses are not recommended. So especially in case of healthcare workers. So once they are protected, like once they are given with this vaccine, so we need not to check the like antibody titer, and we need not to take the like booster doses. So why? Because like why? Because this memory cells. So we have the like memory cells. So even in the future also, like if they are exposed to the like infection, so this memory cells get stimulated faster, so that automatically antibody titer increases. So here under NIP, so for children or for newborn, okay, for neonates like under NIP, so National Immunization Program. So hepatitis B vaccine is given at birth. So immediately after birth, like it is given. So especially like if the mother is positive for like a hepatitis B. So if the mother is positive for hepatitis B, so immunization at birth is mandatory. So here total 4 doses are given in the newborns, such as at birth and at the age of 6 weeks and 10 weeks and 14 weeks. So you can see in this picture. So the first dose is given at the immediately after birth. So such as 0.5 ml it is given. And next, 3 doses of pentavalent vaccine is given. So pentavalent vaccine, it consists of 5 immunizing agents in one injection. So what are those 5 immunizing agents? Like diphtheria, pertussis, tetanus, HIB. So what is meant by HIB? Haemophilus influenza type B. So this Haemophilus influenza type B causes pneumonia and meningitis, and another one is like hepatitis B. So total like five. It consists of 5 agents and it gives protection from 5 diseases. So here it is a combination vaccine or combined vaccine. So how much this pentavalent vaccine is given? It is given 0.5 ml at the age of 6 weeks, 10 weeks, 14 weeks. So it is given intramuscularly. The site is like anterior lateral side of the mid thigh. And see, there should be a minimum gap of 4 weeks should be there. So like in between the like 2 doses. So here 6 to 10, 10 to 14. So minimum 4 weeks gap should be maintained. So here the vaccinated persons, so they are protected. Suppose after vaccination, if anti-HBsAg antibody titer, if it is more than 10 milli international units per ml in their serum. Suppose if antibody titer is more than 10 milli international per ml in their serum, that indicates that they are protected. So how long this vaccine will give protection? This will give protection for 25 years or like uh, even longer. Next, passive immunization. So passive immunization is done after exposure to the infection. Suppose if any person is not vaccinated, if they are accidentally exposed to the like infection, generally we'll give the like a passive immunization. So remember, passive immunization is done by giving of ready-made immunoglobulins. So the main advantage of this ready-made immunoglobulins is like it gives immediate protection, but the disadvantage is it is for short lasting. So active immunization is done by giving of vaccines, that is done before exposure to the disease. That is, the aim of active immunization is to prevent the clinical attack. So passive immunization is done after exposure to the like infection. So it gives immediate protection. So here HBIG, which means hepatitis B immunoglobulin. So these immunoglobulins, such as antibodies, they are prepared from high donors with high titers of anti-HBs. So how much it is given? It is given like a 0.06 ml per kg of the body weight, which means 10 to 12 international units per kg of the body weight. It is given intramuscularly in a single dose. So it should be given as early as possible, preferably within the 48 hours of the like exposure, not later than the 7 days. So what is the main advantage of this one? It gives immediate protection, but it is temporary only. So this gives protection for only 3 to 6 months. Indication. So when we should give this passive immunization? So when we should give this passive immunization? So if there is any accidental percutaneous or permucosal exposure, such as like during surgical procedures or any like dental procedures, okay, if there are any cuts on the skin or on the mucosa, then like we should give this like passive immunoprophylaxis, such as in case of doctors or surgeons or nurses and laboratory workers. And next, exposure of infant born to the like HBsAg positive mother. Suppose if the like baby born to the like HBsAg positive mother, then we should give. And after having the like a sexual contact of known HBsAg positive person. So here, if the person is having the like a hepatitis B like positive, so if the host is having the like a sexual contact with them, then we should give the like a immunoprophylaxis, passive immunoprophylaxis, and protection against the HBV infection after liver transplantation. So after liver transplantation also, so to prevent hepatitis, we'll give the like immunoglobulins. Next, combined vaccination or combined immunization. So what is meant by combined vaccination or combined immunization? That is simultaneous administration of vaccines and immunoglobulins. So as we discussed, so vaccines will give the immediate protection. Okay, it will take, like, sorry, vaccines will give the protection, but it will take some time to act. Like immunoglobulins will give the immediate protection, but it is for short lasting. So in the combined vaccination, we'll give both vaccine as well as the like immunoglobulins. For whom we'll give this combined immunization? So this is given for the neonates, newborns who are born to the like HBsAg positive mothers. So immediately after birth, we'll give HBIG, hepatitis B immunoglobulin, that is 0.5 ml is given intramuscularly immediately after birth, and after that full course of hepatitis B vaccine, which means 4 doses of like a hepatitis B vaccine. So the first dose only hepatitis B vaccine is given, and at the age of 6 weeks, 10 weeks, 14 weeks, pentavalent vaccine is given. So the first dose should be given within 12 hours of the birth. Next, treatment. So this infection is self-limiting and it do not require any specific treatment. So antiviral agent, like antiviral agents are given only in case of chronic hepatitis B infection. So in case of acute hepatitis B infection, we need not to worry. So here, generally we'll give tenofovir and telbivudin. So these are the antiviral agents. So tenofovir and telbivudin, these are the antiviral agents of the choice. And other agents such as we can give the like entecavir, adifovir, and lamivudin. But generally, tenofovir and telbivudin is preferred. They're like nucleoside analogs. So entecavir, adifovir, and lamivudin is like less preferred because like they develop the like resistance. Okay. Previously, we used even pegylated interferon alpha. So now we are not using this pegylated interferon alpha because it is causing adverse effect or it is causing the like complications. So that's what we are not using. Thank you.